Hello, today's everyone, and welcome to the Foundation and Northwell Health program, Exercise and Parkinson's. The program will begin shortly. Today's program is a webinar. Attendees will be muted and off camera during today's presentation to help reduce background noise and echo. There will be a short introduction before today's presentations. After the presentations, we'll have questions from our audience for a moderated Q&A. Your questions can be submitted by clicking on the Q&A icon in the black banner on the bottom of the viewing page. We will do our best to address as many questions as we can. If you have any technical challenges during this meeting, please let us know via the Q&A box and we'll respond as quickly as possible. For optimal viewing of our speaker, please choose Speaker View at the top right-hand corner of your viewing page. We'll begin promptly, actually right now. All right. So hello and welcome to today's program, Exercise and Parkinson's. I'm Donna Sperlakis, Senior Director of Community Engagement at the Parkinsons Foundation. The Parkinsons Foundation is pleased to be presenting this program in partnership with Northwell Health. Today's program is also being broadcast live via Facebook, so a special shout out to those who are joining us today on Facebook. Today's program will be recorded. A link to the recording will be sent to you via email in the coming days. If you're joining us for the first time, welcome. I'd like to take a moment just to share a bit about the Parkinsons Foundation. The Parkinsons Foundation makes life better for people with Parkinson's disease by improving care and advancing research towards a cure. We're the nation's leading community for people with Parkinson's disease, the people who love them and all those who are working to end the disease. Every day and in everything we do, we're working to make life better for people with Parkinson's. To achieve our mission, we pursue three goals. First, improve care for everyone with Parkinson's. Second, advance research towards a cure. And lastly, empower and educate the global community. We provide many free resources, including our website, parkinson.org, where you'll find information about the Foundation's research, current initiatives, and upcoming events. Our website also provides information about living with Parkinson's disease, webinars, podcasts, and print resources for download. In addition, you can order a hospital safety kit, our newly diagnosed toolkit, and any of our educational resources via our website. Finally, our toll-free helpline at 1-800-4PD-INFO is available to answer your questions or help with accessing our educational resources. At this time, I want to acknowledge our partner, Northwell Health. Without their support and collaboration, today's program would not have been possible. We're excited to work with them to bring the greater New York PD community valuable Parkinson's education programs. So without further delay, it's my pleasure to introduce our speakers today. It's a pleasure to welcome back our first speaker and program moderator, Dr. Alessandro Di Rocco. Dr. Di Rocco is a world-renowned leader in the field of Parkinson's disease and movement disorders. He has been the principal and co-investigator of numerous research studies, including NIH and major national and international foundation-sponsored studies, and has been awarded nearly 24 grants to support his research efforts. He's authored over 90 articles, 12 books and book chapters, over 125 abstracts and other publications. Dr. Di Rocco serves on many advisory boards and committees, including the Parkinsons Foundation Board of Directors. Dr. Di Rocco will be joined today by a team of Northwell Health experts, including Kimberly Valente, art therapist, Evelyn Torres, physical therapist, Katie Schlosser, occupational therapist, and Tina Fischetti, speech and language pathologist. Dr. Di Rocco, I'll turn it over to you.
Thank you, Donna. And it's a real pleasure to be part of this discussion and to sort of highlight what is really a core mission in our treatment of Parkinson's disease, which is an emphasis on what goes beyond the medicine, what goes beyond the surgery and the traditional treatment for the disease, and an emphasis on an intervention that is so important and so essential, both for day-to-day well-being, but also for the disease progression. In the few minutes introduction, I like to use this minutes to highlight the fact that in the past 15, 20 years, if there has been a revolution in the care of Parkinson, that has unfortunately not come from any major breakthrough in science. We're still trying to figure out best way to get stem cells or other interventions working. What has been really significant and what has in many ways transformed the care of Parkinson is an awareness that there is one modality to intervene in the brain and modify the way in which the disease affects the manifestation of the disease and the progression of the disease, and is a modality that is available pretty much to everyone. Now, the fact that it's available doesn't mean that it's easy to use, and the modality is exercise. And the extension of the exercise or this sort of non-pharmacological interventions is rehabilitation. You'll hear from some of our team members at Northwell, where we're really developing an emphasis on the exercise and rehabilitation. And you'll hear how those interventions are especially tailored at any stage of the disease, and how exercise and rehabilitation are sort of an extension of this sort of non-pharmacological intervention. Let me start telling you that when I started my training a number of years ago, the recommendation was that exercise and rehabilitations were really not essential in Parkinson. If anything, you had the risk of falling or risk of injuring yourself, and that was not recommended. A great revolution in science has been the understanding that the brain has the ability to transform itself, a function called plasticity or neuroplasticity. Through this function, the brain can train itself to acquire new skills. So we think of this as we think of skills such as learning how to play piano or how to play tennis or complex skills, but even more sort of ingrained simple skills like walking or maintaining certain daily function requires for the brain to maintain sort of the memory of a certain function. And what is has been an awareness is that this is especially important in Parkinson. One of the elements of the biology of Parkinson is that the brain kind of unlearns how to do certain things. So people with Parkinson may have trouble walking, not because the legs are too weak or too stiff, but because really the mechanism, that synchronicity of walking is just not so well oiled anymore, not so automatic, almost like an unlearning. And as there is an unlearning, we also learn that in Parkinson, there is a lot of relearning that we can do. And there are studies upon studies upon studies that have shown now that at any stages of the disease, an intervention made of exercise and or formalized training as a rehabilitation intervention can achieve two goals, which are extremely important. One is, of course, an improved sense of well-being. And the second, which is probably more important in the long term, is that there is a delay in disease progression, which is quite significant if an exercise regimen is implemented from the early stages of the disease, from the time a person is diagnosed, and maintained throughout. Now, of course, as the disease progresses, the role of specialized therapists is essential. And what therapists do is really a qualified intervention in regaining function. Rehabilitation means again, habilitation, allow ability. So bring back ability, bring back function. And this is really at the core of the intervention in Parkinson's disease. So I also want to add that in all the studies, there is an additional benefit, which is not surprising, is that people who engage in a daily exercise, and I emphasize daily because this seems to be really the key to the success of the intervention. Have not only the two benefits discussed before, so on the symptoms and on the disease progression, but there is also a benefit in the psychological benefit and a clarity of mind and probably a cognitive benefit that plays on in the long run. With this, I sort of take an opportunity to introduce a wonderful team of therapists here in Northwell, with whom we are sort of articulating our sort of work, which is, of course, with the use of medication and in selected cases with surgery, but with a great or the greatest emphasis on exercise and rehabilitation. And I'm delighted to introduce Ms. Evelyn Torres, one of our senior physical therapists. Evelyn.
Thank you, Dr. Di Rocco. Yes, my name is Evelyn Torres. I'm a physical therapist here at Glen Cove Hospital. And I'm going to be discussing the role that physical therapists play in treating patients with Parkinson's disease. With Parkinson's, there are many, many symptoms that can present themselves, but I'll be discussing more of the slowing of movement, stiffness, rigidity, impaired balance, and gait dysfunction that you may see, very commonplace with this patient population. So as Dr. Di Rocco was saying, these symptoms will worsen as the disease progresses. So in conjunction with medication, the physical therapist can assist in slowing down the progression and improve the functional independence of these individuals and their overall quality of life. So the symptom of bradykinesia, which is the slowing of movement, this can cause very simple tasks to be difficult and time-consuming. So for example, someone getting out of bed or just transitioning up from a chair can take a long time. Even with ambulation, you'll see this very common shuffle-like gait, very short, quick steps, or their feet can be dragging when they walk. So the treatment of this will focus on over-exaggerating movements, large amplitude movements, and reciprocal movement patterns. So things like, for example, we have certain equipment we can use, a seated elliptical, for example, to mimic this reciprocal movement. We can do things like boxing, because, you know, just kind of forward punching, anything, large amplitude reciprocal movements. And we want repetition of task-specific activities. This can help with the bradykinesia, the very slow movements. Another symptom you may see is the rigidity or the stiffness, and this can occur in any body part. It can be painful and limit range of motion. This leads to inactivity, dependence on others, and possible social isolation. So to treat this, stretching is key. It's crucial to increase their mobility. And you'll see, it's very common to see this very flexed and stooped posture with patients with Parkinson's. So they can develop tight pec muscles, hip flexors, hamstrings, calf muscles, trunk muscles, because they're sitting a lot. So these muscles tend to get very tight. So stretching at frequent intervals throughout the day can be better than just doing it once a day. It can really counteract the stiffness, and the therapist will develop a program specifically for that patient to stretch those muscles that are affected. Balance is another area that can be affected with patients with Parkinson's disease. And this can lead to them being a very high fall risk and being very fearful of falling. So again, the vicious cycle of immobility and just a vicious cycle. And there are many reasons for balance impairment. For example, is it their visual system, postural control, vestibular system, sensory system, musculoskeletal abnormalities? The interplay between these systems can be affected. So the therapist will develop exercises that focus on addressing the reason for the balance impairment. And they'll assess these areas, teach compensatory strategies if necessary, and this in turn will improve the patient's confidence and overall safety with mobility. The other key area is the gait dysfunction. As I mentioned earlier, you may see this very typical shuffle-like gait where the patient is taking very quick, short steps. And they also can demonstrate freezing during ambulation, where they're walking and all of a sudden they just stop. So to treat this, you may see therapists using different types of cues. It can be auditory cues, such as a metronome, or finger snapping, tapping, any of these things, or stimuli from the environment. We can use things like lines on the ground, obstacles, like stepping over canes, Post-it notes, a variety of different things we can use as tools to help facilitate automatic and repetitive movements. We often will use objective measures, something that's called a 10-meter walk test or a timed up and go. This will be assessed at initial evaluation, midway, and towards the end. It shows progression, it shows progress. And so that way also patients can see how they're getting better, how their gait has improved. There are different types of gait aids we can use depending on the patient and what they need. Do they need a regular rolling walker or maybe a U-step? So a U-step is a specialized rolling walker that was designed specifically for patients with Parkinson's, and it has a built-in metronome in it, so it'll beat, and it gives them that rhythm, and that way they can follow those auditory cues to help improve their timing, the timing of their steps. There's also a laser on the bottom of the unit, so it gives them that feedback where they can increase their strides because their feet are trying to step to where that laser is. That way they can also help increase their strides. So it's just another tool that can be used during ambulation. Studies have shown that walking speed and stride lengths improve with physical therapy. So as Dr. Di Rocco was saying earlier, exercise is really, really important for these patients. Muscles atrophy and weaken as we age. So strength training is also important for Parkinson's patients. It can be incorporated to address imbalances that cause weakness. So also exercise strength training is good because it helps to it can prevent osteoporosis and cardiovascular disease. So it depends on what stage the person is in, but resistive exercises can be also incorporated, things like weights or resistance bands. So the general idea is that the bradykinesia, the rigidity, musculoskeletal imbalances, impaired balance, will affect the ability of these patients to function independently. So our job as physical therapists is to use a vast array of tools to address these symptoms, to improve their mobility and regain as much independence as possible. Thank you. The next presenter will be Kimberly Valente.
everyone. Thanks, Evelyn. My name is Kimberly Valenti. I am part of the recreational department here at Glen Cove Hospital. I am a creative arts therapist. I have been with Northwell for the last few years, but I'm actually quite new to the Glen Cove Hospital, rehab and hospital. So it's really wonderful to be part of this team and see how everybody operates. Like I said, I'm part of the recreational department. A lot of people wonder, what is recreational therapy? So I'll tell you a little bit about recreational therapy and how recreational therapy goes hand in hand with art therapy. We really work together in this department. So recreational therapy is a form of therapy that utilizes recreational and other leisure-based interventions to address the needs of our patients here in the hospital. As just a means of psychological and physical health, just in recovering and well-being. As Evelyn had explained before, it's extremely important with alleviating any kind of negative association with social isolation. Recreation is just a wonderful tool that exercises the mind, body, and spirit of our patients, which is so important. As far as art therapy goes, which is really my wheelhouse, art therapy involves the use of creative techniques such as drawing, painting, collage, coloring, sculpting, really anything creative. It could be poetry, it could be music, to help our patients express themselves in an artistic way and examine really the psychological and emotional undertones of the art. It's really wonderful. Actually, I have an example for you guys, nothing that patients made, but I actually bought this little door down in the gift shop, which is really lovely. What we like to do is this actually came with the door, but one of our art therapy exercises that we've been using is to ask our patients, especially with Parkinson's, to think of something that they desire, or a long-term goal or a short-term goal, whether it's they say it, they try to write it down, or we have the assistance of a family member, and we try to make it as creative as possible. Whether it's painting, writing, doesn't matter, just as long as there's something that they can express what they want, what their truest heart desire is. And what we do is we put it on the other side of the door and we let them open it with their fine motor skills, try to engage as best as they can, or we assist them with it. But it's just a really nice exercise that we use to engage our patients to ensure that they have, something that's on their mind to kind of push them in the right direction creatively. Another thing that we use is, in the recreational world, we have music, the therapeutic art of music. So I have my ukulele. I also have a guitar as well. We do a lot of singing. We do a lot of community, trying to bring everybody together, different cultures, different kinds of music, dancing, singing. It's a really beautiful way of bringing our patients together as far as getting them engaged creatively. I think with our program recreationally, it's quite unique and beautifully diversified, because really what we do is we partner with the interdisciplinary team, really just to construct a highly diverse schedule for our patients on the units, just to enjoy a plethora of really beautiful daily opportunities, to engage our patients creatively, socially, spiritually, physically. And the purpose of these programs is just to ensure that our patients are taking part in a really enriched program to stimulate their mind, body, and spirit. Just a few examples that we do as far as activities go. We offer daily art therapy groups, hope and wellness groups with our hospital chaplain, Brenda Ford, which is really very beneficial to our patients, especially those who are religious. It doesn't matter what religion that you follow or whatever it is, it's just having that bit of hope is really very beneficial for our patients. We also have various physical activities with adaptive sports, which is really fun for our patients to see, especially if they're have played sports in the past or anything like that, or if they played games in the past, they've been a bit discouraged, like, oh, I used to play this, but I don't play anymore. But with recreation, the beauty of recreation is that we have really adaptive modifications to really boost their confidence and say, yes, I can still play golf with the assistance of us and, the right supervision. Feel like bowling, we do have adaptive bowling, all hands on deck with that one. But guess what? As long as they're having a little bit of fun and enjoying themselves, and that's our utmost priority with the recreational department. We really try to emphasize that, you're working really hard here, and it's really, really important for us to fit in a little bit of fun, squeeze in a smile, make sure that you're having a little bit of fun here at the hospital while you're recovering. It's extremely important, and being in the hospital is an extremely isolating experience, even the rehab, extremely isolating experience. So our utmost priority is to ensure that those needs are being met emotionally, spiritually, physically. Yeah. So thank you so much. I will hand over to our occupational therapist, Katie.
Hi, everyone. I'm Katie. I'm an occupational therapist here at Glen Cove Hospital. So just a little intro if you're unaware of what OT is. It's treatment used to develop, recover, maintain, and improve performance and participation in what we call activities of daily living, so ADLs for short. We focus on adapting the environment, modifying the task, teaching the skill, and educating the client as well as the family member to increase and improve the participation of those ADLs, specifically the ones that are most meaningful and important to the client that we're working with. So when is OT indicated for people with Parkinson's? Specifically when there's limitations in activities or participation in any of the following areas. So self-care, mainly, functional mobility, transferring, getting on and off the toilet, in and out of the shower, IEDLs. So those are, shopping, meal preparation, laundry, bill pay, medication management. Anytime there's difficulty, if the client is a primary caregiver for family members or even pets, difficulty with work, leisure, and also for the caregiver or care partner, if they're experiencing problems in supervising or supporting the person with Parkinson's in their daily tasks. So Evelyn touched upon some motor symptoms. There's both motor and non-motor symptoms involved with Parkinson's. The tremors, rigidity, freezing, falls, muscle cramps, decreased coordination, stoop posture, slow movement, decreased motor planning, difficulty weight shifting when engaging in any sort of mobility, reduced arm swing, decreased amplitude, dexterity, fine motor coordination, manipulation of things in their hands, as well as increased time to complete those tasks. How that can affect our ADLs, that's difficulty with buttoning, writing, cutting food, cell phone use, and even retrieving things from your wallet. Some of the non-motor symptoms that you may see are mood disorders. So depression, anxiety, maybe increased irritability, cognitive changes such as problems with focusing, attention, planning, decreased thought process, maybe personality changes, difficulty multitasking, problem solving, decision-making and organizing. Those specifically can impact IADLs, as I spoke about before. So how does all of this, how does exercise, I should say, impact all the things that I just mentioned? So research has shown that exercise can improve flexibility, balance, coordination, and strength. Improvement in flexibility can lead to better posture, better movement. As Evelyn touched upon before, stretching is huge. Stretching should be done daily. Research has also shown that exercise may delay some common symptoms in Parkinson's that I just mentioned, specifically the motor symptoms. Exercising safely is extremely important. So exercising when you're on your on period. So timing your medication, taking them on time, and that in conjunction with your exercise. Staying hydrated, super important, as low blood pressure and dizziness are common symptoms in Parkinson's. And just being super aware and attentive to your symptoms as you're exercising, both motor and non-motor, because they may increase your risk of falls if you feel that sudden onset, maybe some dizziness or lightheadedness, to just be aware of that. Aerobic exercise specifically, research supports promoting positive changes, not only in the motor function, but cognitive changes in the brain, as Dr. Di Rocco mentioned earlier. Doing activities that require planning and sequencing in conjunction with your motoric exercises can also improve your cognition, because now you're shifting your attention, you're multitasking. So you're kind of killing two birds with one stone. My treatment specifically, I focus a lot on amplified movement, specifically the concepts of LSVT, programs specifically geared towards Parkinson's. Typically, it's a 4-week program run 4 consecutive days for the 4 weeks, so 16 sessions. Again, I use kind of the principles and concepts that amplified movement to help slow those small movements. Well, excuse me, to help improve those smaller, slow movements. So some treatment and exercise that can be used to focus on improving the symptoms of Parkinson's. As I just mentioned, LSVT big. You can rock steady boxing, dance for Parkinson's disease, Tai Chi, and yoga have all been proven to improve on those symptoms that you may experience. So just to rewind a little bit, timing your exercise, not only in your on times, but also for completing your self-care tasks. So maybe getting dressed and doing your bathing when you're on. I know, typically you're getting dressed in the morning, but timing for when you're on so that you can complete it more effectively, more efficiently, so that you don't have to rely on someone who can do it, who will have to help you do that. Allowing yourself the time to do that, making sure you have enough time. If you have an appointment, kind of giving yourself a schedule throughout the day when you're going to complete certain things. Maybe even things to just modify, like pre-buttoning, pre-fastening your buttons, pre-threading a belt. Again, using those large amplified movements throughout, whatever you're doing in your day. It's proven to help. And then as far as like modifying the environment and just giving recommendations as far as equipment and things of that nature. So some things that we can recommend for dressing are long-handled reachers, long-handled shoehorns, dressing sticks, sock aids, compression sock donners, button hooks, zipper pulls, even magnetic jewelry clasps, magnetic clothing, lock laces, elastic shoelaces. Honestly, the list goes on, it's endless. So some equipment for the bathroom, commode, raised toilet seat, handheld urinal, shower chair, tub transfer bench, grab bars, handheld shower, non-skid mats, all ways that you can adapt the environment to improve that independence and self-care and mobility. Some equipment for improving independence with meal prep, handheld electrical can opener, jar openers, microwave caddies, rocker knives, liftware, kind of counteracts the tremor if that is something that is present. Built up silverware, ergonomic handles, scoop plates, all things that are proven to be helpful, and I've seen a difference in my patients after recommending, of course, if it's appropriate. So in closing, that's kind of what OT is about, modifying the environment, adapting and really just trying to regain that independence and self-care and, you know, completing things that are important to the person, finding that way to make it happen. That being said, I'm going to pass it off to Trina, speech therapist.
Hi, everyone. I'm Trina. As Katie said, I'm a speech therapist here at Glen Cove Hospital. And kind of building on what everyone's been talking about, the importance of exercise. In speech therapy, we really use the physical exercise portion when we're addressing the swallowing, which can be one of the biggest factors that people tend to see speech therapists for. My hope is that as we learn more and as research will hopefully show more and more, we will start to address these issues before we have a huge problem with it. Aspiration pneumonia, food and drinks going down into the lungs and causing pneumonia still is the leading cause of death in people with Parkinson's. And unfortunately, I feel like until recent years, people didn't seek out therapy until after they had an event. They had an aspiration pneumonia, they ended up in the hospital, they ended up ill, and then they were seeking therapy. And of course, therapy can help to bring back some of the function. But my hope is that in your daily exercise, with the movement, you'll also incorporate some of the swallowing exercises that can be done. It's not too extensive. They're pretty easy to do. There's physical exercises that we can do. And there's also devices such as the expiratory muscle strength training that have found to really make a difference in swallowing. And also the voice amplification programs that are used like Speak Out or LSVT have also been found to benefit swallowing at the beginning and as the disease progresses. The other things that we really work on in speech therapy is the actual speech, the clarity, the intelligibility of how the words are coming out. That can change over time. There can be slurring sometimes with words, so the clarity isn't really there. There can be freezing of speech at times, and those are all things that can be addressed with exercise. We work with voice. One of the most universal complaints is a change in vocal quality and vocal intensity. So the volume tends to decrease as time goes on. Frequently, I will get that more from the family than the person with Parkinson's, because they will say, no, it must be everyone else. But we do find that there is a significant change over time in the vocal intensity, and there are programs designed specifically for increasing your volume when you speak, and that tends to change your intelligibility overall. And as I said before, it also has been found, these programs have also been found to help with swallowing function. Speech therapy will also address language changes and cognition changes. You know, as Katie talked about, a lot of different things can change, primarily attention, memory. People will say that they're having more trouble with focusing on things, with finding the words that they want to say, with planning the activities that they need to do, the scheduling that they need, taking care of their medication, which changes dynamics between them, their care partners. Our goal is to maintain independence, for you to be able to do as much as you can for yourself, and really take ownership of the things that you need to take care of. And all of these things, we tend to think of exercise as the physical, but it's just as important to exercise the mind. The brain acts as a muscle as well, and it is very important. And unfortunately, it's a bad cycle, as Katie and Evelyn both said, that the reduced interaction, reduced mobility, it all can change your mental capacity as well. If you don't use it, you lose it. That's true of everything, whether it be your physical ability or your mental ability. So it's very important to make that mental exercise a part of your everyday. Try to start reading. A lot of people will tell me that they have trouble with reading. They've lost interest. It's something that they really enjoy doing, but they really can't focus on it anymore. So really taking some time and setting time aside and not trying to dive in too quickly. Maybe put 5 minutes at a time aside. And put some time aside where you're going to really focus on doing your exercises for your swallowing, your exercises for your voice and for your speech, and your exercises for your brain. It doesn't have to be things that are necessarily what we think of as therapy. It can be anything from playing cards, playing video games, playing games, board games with family members, even better, something that's interactive and includes the whole family or friends. It's anything to really make your brain work a little bit more, that planning, that attention. And even during physical exercises, Katie pointed out earlier, it really helps overall. And we find that as people have an easier time with communication, have an easier time getting around, their interaction with their families, their friends increases and improves. They find more leisure activities, as Kimberly was saying, that really help them become more social, whereas they might have stepped back a little bit because of the difficulties with either their communication, their voice, their cognition. And we find that it's really a package deal. It really is important to focus on the body, the brain, the spiritual, as Kimberly said. Everything needs to be in a good place, and we really suggest a good care team where everyone works together and to really optimize your goals, and of course to what you want. You're the biggest part of that team, obviously. But really seeking out the therapy, I think, is really important. Not waiting until something goes wrong, until you've had a significant fall or until you have an aspiration pneumonia. Really looking for those programs from the beginning and maximizing your function now and maintaining your function to have that good quality of life. That's our ultimate goal here. Thank you.
All right, thank you all so much. That was great information. We did receive a few questions, so we're going to take some time now to answer some of the questions that we received from our audience. And we're going to bring all our panelists back to join us, so as everybody comes back on. So I think I've got a couple questions for each of you. And I think, Trina, since you just talked, I'm going to just throw one right at you right away. We actually had a couple of questions from people asking about shortness of breath, and if they have shortness of breath and it makes it difficult to exercise. Is maybe speech something that can help people with shortness of breath?
Absolutely. One of the things that we noticed that they find some difficulty with coordinating that breath support with even communication. There's a lot of work being done with expiratory muscle strength training. It's an actual device that you do. It's a specific program. You do 5 sets of 5, and you increase the pressure on the device daily. And even here, where we see people for about 2 weeks, it is intensive. It is a daily thing that you do. We're finding a pretty significant difference in a pretty short amount of time. So I think that, combined with the fact that they are receiving occupational therapy and physical therapy, really does make quite a bit of a difference for people, and it helps with their vocal volume as well.
That's great. Okay, good. Let's see, Evelyn, this one's for you. After a total knee replacement, I developed retropulsion. What can be done for it? And maybe tell us first what retropulsion is in case people don't know what that is. And is there anything that can be done for it?
So retropulsion is when an individual tends to fall backwards. And that happens for a variety of reasons. After a total knee replacement, chances are there's a lot of swelling and stiffness in the joints. So chances are the ankle is probably also a little limited in the mobility and might be more plantar flexed. So that may be causing the individual to fall backwards if they don't have the ability for the ankle to flex like it normally would when we go to stand. The tibia rolls over the talus, so basically causing what's called dorsiflexion, right? The ankle to bend up. And it's possible that it could be from tightness from the ankle. And it's not just the knee. The knee is also a limiting factor, of course. It's not also bending like it normally would. So it's multi-joint. It's not, you can't just look at the knee. You have to look at all the joints around that involved joint. So with stretching and calming that edema down can really help with that retropulsion, getting your body weight forward.
Mhm. Great. Okay, thank you.
Sure.
All right, Kimberly, this one's for you. Can recreational therapies, different types of rec therapies, be a way for people who have maybe more advanced Parkinson's to exercise, to incorporate exercise into their daily routines?
Yeah, definitely. I feel like something like that, as far as just exercise goes, just increasing and building endurance, just using their, their interests, and, it's even like music, even like, if you kind of ask them where they, where they're from, what are their cultures, things that they've grown up with. I think as far as like building endurance when it comes to that, I feel like just kind of meeting them in the middle as far as their interests goes. That's definitely something that we like to use. And, using, just various resources and things like that would be able to be of major assistance as well.
Okay, good, great.
Mhm.
All right, Katie, I'm going to give you this one. So a couple of questions about just, increasing weakness. This person here is asking about walking. She and her husband, try to walk every day. His weakness is getting more, it's increasing. Suggestions for how they can keep walking. Someone asked about Nordic walking. Maybe that's a question for Evelyn. I don't know, but are there devices, are there assistive ways that they can continue to walk together?
So I'm actually going to hand this off to Evelyn because she
Okay.
is the ambulating queen expertise. She would better be able to give you a more appropriate response, as that's her
Sounds good.
expertise.
Okay, so repeat again for me, a patient walking with her husband, is that what you said?
Yeah, so they walk a lot. She's talking about his weakness increasing. So are there things they can do for him to be able to continue walking? And I don't know if it's even related, but someone asked about Nordic walking. Is that an option for that situation, or is that more intense?
To be honest, I'm not really sure what Nordic walking is. If I not really sure what that is, but it's hard to say without actually evaluating the
Yeah.
person. Maybe the person can benefit from a gait aid. I'm not sure if they're using one now, if they've tried different ones, have they gone to physical therapy so that they can be assessed? What's the reason that they're not able to walk more? Is it pain? Is it stiffness? Is it, decreased range of motion? It could be so many things. So we would have to address those things to then be able to, help this individual be able to ambulate more. And we can use devices, we can use body weight support over a treadmill. There's so many things, but without really knowing what the problem is, we can't fix it.
Right.
Sorry, I didn't have a better.
No, that's okay. And I know that's often the case. It's hard to say. There's not a blanket answer for every patient.
Go see a good physical
very
therapist.
Different. I like that. That's right. Go see your therapist. All right. So, Dr. Di Rocco, I'm gonna send you a question. Let's see. I just had it here. Where did it go? looking at exercise. So oftentimes people say, you know, how do I know when I'm doing too much? So I exercise and I don't feel better. Am I doing too much? So is there a prescribed amount? Is there an exercise that's better or worse? Maybe that's more a question for the team, but I'll start with you.
Well, let me give an answer that one of my colleagues used, so I won't claim that for me, but she answered in response to what's the best exercise, the one you'll be doing. I think that struck me as real for me, I think for all of us. And I think that, you know, if a certain form of exercise, if dancing is your pleasure and you're told to do, you know, start doing boxing, which you hate, or vice versa, then, you know, you won't do it. The other question is about dosing. Dosing refers not just to how many milligrams of pills you're going to be taking, or how many times a day you're going to take a certain pill, but there is a whole sort of ways, whole sort of effort to understand what is the ideal amount of exercise that's needed. And there have been different studies that have been looking at this. The key answer, I think, is continuity. So the key answer is that you do exercise not, you know, twice a month, but you do it every day. Of course, you know, you'll skip a day here and there, but the best results that have been shown, especially in studies that look at modification of disease progression, have shown that if you exercise at least 6 times a week, that's when you get the benefit. As per amount of exercise, you know, there are different variables. Some were discussed just now. You know, certain people can actually spend more time exercising. For other people, the endurance is diminished. So a good physical therapist or any other therapist who can guide you and help you define what is your best way to sort of engage your body, your function, and sort of being aware of some of the limitation you may have is key. So I think that I'll dissect the answer in try to exercise every day, or at least 6 times a week, and do something you enjoy doing. And that's, I think, is the key.
Good, good. And so I guess people are asking, you know, what's more important, duration or intensity, or does it not matter? Is it just kind of back to, you know, do something every day?
You know, it seems that the doing it every day is probably the key element in a lot of the studies that have been done and a lot of the observations we have in the clinic.
Yeah.
Now, I think it's better to take a walk every day, half an hour or 45 minutes walk every day, rather than walk, you know, once a month for 10 miles or 50 miles. You know, I think that plays out. The brain also has a way of sort of modifying. Remember, I go back to the biology. A lot of what we're doing is we're not just exercising muscle and joints and the cardiovascular. This is all great, all secondary benefits. But the exercise we're doing, we are training the brain. So we are inducing modification in the brain. And the brain has a way to learn and relearn by repeating certain functions. So the time, the repetition, the frequency is a key element in, again, the key principles of neuroplasticity.
Okay, interesting. Thank you. All right, I think I'm going to just put this question out there to anybody. So obviously, one of the things that people with Parkinson's struggle with on a daily basis is fatigue. So anybody have any thoughts about, you know, how you might help overcome fatigue, maybe in your particular area, if that's something that you are able to address? So if anybody wants to answer that one, I'll let you.
So typically energy conservation is important. You want them to be able to do the tasks, their daily tasks, and have the energy to do that. So just knowing that balance between, you know, your body. So you want to push yourself as much as you can to do what you can do. And you don't want to over fatigue. Now you don't have, okay, you just did all these things. Now you don't have energy to, you know, walk to the next room or whatever it is. Just everyone knows their body. So you just want to little by little improve the endurance. And there's ways to do that, but you can't, like Dr. Di Rocco is saying, you don't want to jump from A to Z. You have to do it in steps. And working with people that are trained to do that can help guide that. That's my spiel on it.
I agree, even with the mental exercise, whether it's the mental, the swallowing, the voice, you know, doing a little bit at a time. I think also with the medication, really timing it where you're at your optimal point as well. And trying to increase a little bit every day, you know, doing a little at a time. But and I also think it's important to put aside specific time, because I know it's just human nature. Yeah, I'm going to do a little bit of it a little bit later. So I think something I always try to have people go home with is the idea that this is part of my job now. Okay, this is going to be my job from 10 to 11 every day. I'm going to do these 5 things to really schedule it, to make sure that you are giving yourself that time.
Yeah, that's a really good point.
To
I
prioritize.
totally agree with that. Yeah.
Exactly.
And incorporating programs of interest in there too, I think is a big one also.
Mhm.
Yeah.
Great. That's really helpful. All right. Katie, you had mentioned different assistive devices. And so someone's asking where to go and find those. Where can you find some of the things that you were talking about?
So you could definitely go to really any pharmacy. Will have, you know, your shower chairs, your commodes, those basic things. Honestly, I oftentimes just recommend and give my patient a printout of whatever the device is off of Amazon. Amazon has everything. All of the things that I listed, to be honest, everything can be found on Amazon.
Awesome. Okay. And it's just a matter of finding things and trying what works for you. And
yeah, I mean, obviously under the direction and guidance of you know, skilled OT or skilled PT, you know, you can also go through, you know, venue of your insurance, see if they cover anything. But if not, you know, seek that guidance from a skilled therapist.
great. Thank you.
Yep.
If I can just add on to what you just said, that I also think it's important when you are seeking therapists to find therapists that are a bit more versed in your specific, whatever it may be. We're discussing Parkinson's, so it's very important to find a physical therapist, OT, a rec therapist, art therapist that really knows a little bit more about what's specific to you. They will have a better idea of what the best exercises are, what the best equipment is, because this is what their expertise is in.
Absolutely.
Great. And then just one last question I'm going to ask Dr. Di Rocco. So if a patient wants to access different therapies, should they ask their doctor? Should they, you know, I'm very aware that not every doctor is going to always prescribe therapies. So what's the best way to have that conversation with their physician if they think that they want to have something?
I think that we do need to have the conversation at the time when we assess Parkinson. So the model of care is evolving, and in my mind should be evolving towards a team effort. And you know, it's not just a dialogue between the doctor and the patients, but a team of professionals who really work together. And in this case, you know, there may be the necessity for a referral from the physician, but the discussion and the dialogue should be with the doctor, should be with the therapist, should be with the care team. And it should be an integral dialogue. I cannot tell you how many times I've learned about important observation in the care of patients that I received from my colleagues, the therapists, whether it's speech therapist or PT or T, that help really inform the discussion I had with my patients, and I hope vice versa. Sometimes I can sort of provide some feedback about my understanding about the case, but key is being open and being aware that it's not an extra. It's not like at the end of the discussion when we finish talking about the medications and this and that, and then okay, by the way, just move, do some exercise. It's a key element, and I think this is what I think this team hopefully has been able to portray, that in the long term, in the short term, and the long term well-being, physical, psychological, and cognitive, as my colleagues have remarked at different times, really this is a key, not a marginal, not a secondary. This is a key modality of treatment for Parkinson.
Definitely, definitely. Thank you so much. Thank you all so much. So I've got just a couple of closing comments here. And so again, thank you, Dr. Di Rocco, Kimberly, Evelyn, Katie, and Trina for joining us today to share your knowledge and expertise, and especially to all of our attendees for your participation today, sharing your questions. We do appreciate your feedback. So as our program concludes, a window will open with the link to complete an evaluation for today's program. I hope you can take a moment to respond. We do use these evaluations to help improve and plan future programs. Also, a reminder that today's program has been recorded, and so a link to the recording will be sent to you via email in the coming days, along with a link to complete a program evaluation if you aren't able to do so today. The Parkinson's Foundation provides weekly education and wellness programs in a virtual format through our PD Health at Home series. And so we invite you to participate each week in our PD Health at Home events, including Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. Visit parkinson.org/pdhealth to learn about upcoming events and to register. Also, please join us for the next program in our partnership series with Northwell Health. On the menu, Nutrition in Parkinson's. That'll be taking place on Tuesday, November 9th, also at noon Eastern Time. I invite you to visit parkinson.org/nutrition-li for more details and to watch your inbox for a personal invitation in the coming weeks. And in closing, the Parkinson's Foundation is here for you. Please visit our website at www.parkinson.org to learn more about our expert care centers, research initiatives, or to download free educational resources. If you had a question today that was not answered, please reach out to our free helpline at 1-800-4PD-INFO or email helpline@parkinson.org. We thank you again for joining us, and we hope you have a wonderful week. Bye.